Hi, good morning. If we have to ask one question to understand the healthcare infrastructure across the globe of every megacity, what would be that question be? And let me ask you that if I say that one metric which I have measured was deaths per million in each of the megacities across the globe during COVID pandemic. We start from Moscow to London, 2,500 to 3,000 deaths per million. We cross the Atlantic, go to New York, it's 5,000 to 5,500. We come down to South America, there'll be 7,500 to 8,000. And a city like Lima, Peru, which has got the maximum deaths up to 10,000. We go to South Africa, and there we find out again 5,500 to 6,000. What about Indian subcontinent? The city I come from, Mumbai, has less than 1,000. Yes, you heard it correct. We are not the richest. We are not necessarily the most equipped. But we did something right to have such a low death score. And each one of them was recorded because there was a compensation for every death which was done. 24th March 2020, I got a call from my sister Priyanka, wife of Dr. Mufazzal Lakrawala, world's best surgeon, that Mufi has decided to volunteer for COVID war. And she wants me to join. When life has a plan, they don't give a blueprint. They just call, and you have to say yes. And there I was, with a couple of my engineers, 2 accountants, 2 doctors from Mufi's team, few nutritionists, and 10 or 12 volunteers, nursing students, and that was our team, with more than 200 patients. And I'm taking you to the memory lane where in whole of India, the total patients discovered were 20, and we had 200. Because Worli was the first community outbreak of the COVID pandemic. We had no idea what the treatment would be. We at those days thought it's going to be a zombie virus. If it gets touched by us, we will just die, drop dead. And another interesting fact, Mumbai, if all would know, is a vertical city. So just 15 days back, we have shut down 3 major hospitals because the moment a patient walks in, the virus gets into the centralized AC system, no negative isolation, and hence, as a result of this, the entire healthcare ecosystem collapses. And at that point of time, Mufi had this great idea, the most innovative, I'm not saying great, at that point of time sounded crazy, to convert cricket stadiums into the hospitals. And here we were, a team of 20 people, 2 doctors, hardly any healthcare professionals, with 250 patients. When India registered first 50 COVID pandemic patients into multi-specialty hospitals, we have discharged the first 100 of them. And with the confidence growing up, we reached to the number 1,000. But what was bothering us was every time a patient becomes critical, we will go to the multi-specialty hospitals begging them to take these patients, and we would be said no. And that's where Mufi decided to say that we will build our own ICU systems and if required, operation theaters. Now, it was crazy enough to keep critical patients of an unknown disease into stadiums. But now we were talking about building ICU systems. And here we started in next 30 days, we built shipping containers, which has a natural laminar flow, integrated all the medical devices so that all the data gets into the Bluetooth and the cloud system. And through that, it gets beamed into war, or what we called as command center. And there were super specialists. And the idea was to create a complete contactless facility where the super specialists, who themselves were vulnerable because they were above the age of 60, some of them 75 with comorbidities, are not in touch with the patients which has high viral load. But still you should be able to give the care and compassion which you would have given into a multi-specialty hospital. And we launched with a lot of fanfare around 22nd, 23rd of May. Within 30 days, we built these 35 beds for our own hospital, for own jumbo COVID facilities. We built this, and Chief Minister announced it. And within 1 week, to our surprise, we were running the full capacity, because not only the patients were coming from our center, but they were actually coming from centers in and around the multi-specialty hospitals. And as we were very confident that we have actually discharged 1,000 patients without mortality, someone up there has a different plan to test. On 3rd of July, Mumbai got into red alert. And between 3rd and 4th of July, Mumbai got the rain, which normally in the month of July, the entire month gets that much amount of rain. Now, to explain you the geography which we're working in, NSCI is on the Worldly Sea face. On the other side is Haji Ali. And just on the other side of it is the Arabian Sea. In 24 hours, we were without any sleep, and we realized that entire area is flooded. There's not a single vehicle which can come in. We had 35 patients. On 4th July, 11 o'clock, we were panicking. As we had 35 patients, 13 extremely critical on life support out of 3. One of them was my colleague who has actually designed the system, and while designing the system, his oxygen level came down to 75 and 80, and he was admitted to ICU. There was no way any ambulance could have come in or out. And we have a team of 14 people at that night. And suddenly, the dome on which the entire container system was built, the tent, disappeared into thin air. And we were exposed to the Mother Nature fury. That was a moment. In my mind, the next day, headlines in the newspaper was very clear. With a lot of fanfare, we were showing the bravado. And that would become a graveyard for the critical patients. Around 11:15, Mufi said that the only way we will be able to save these patients is we make a makeshift ICU inside the dome, which was the covered stadium. Now hang on, we were already in the makeshift ICU, which we have built over a period of 1 month, using the container system, the cameras, the risk scores, the medicine protocols. Suddenly a nurse walked in and asked Dr. Mufi, "Sir, what if we lose any of the patients while transportation?" It was a 200-meter stretch. With oxygen cylinders, you have to move the critical patients who are in the life support. And Mufi looked into each one's eyes and he said, "I don't care for the patient we lose. I look for the patient we will be able to save. And just one thing, not a single patient should feel that he was not taken care at the last moments of his life." And that was the moment I still get goosebumps. Because next 3 hours, what happened was magic. We were fully exposed because I was talking about that time where the PPEs in India was probably 60,000 pieces we were making. Not enough of masks, not enough of equipments. Every decision which we made was life and death. Morning 4:30, as we woke up, from the slumber of work, not the sleep. With the first sunshine, we knew that we have saved every patient on that night. And as we were walking tired back onto this residence where we were staying, I didn't look at engineers, doctors, nurses, administrators, and volunteers. I just looked men and women walking towards one purpose: save one life at a time. And that's where the identity dissolved towards getting a one larger purpose. We knew that we are onto something which will help us to grow. Next 1 month, we were given the in charge to become 60,000 patients to be handled, 10,000 beds to be put across into various field hospitals. And next 1 year was so much of exchange of data across the globe, because we were setting up not only the intelligent design systems and AI-based risk scores to predict which patient should go into ICU and which patient should not, but we were building an ecosystem of engineers, doctors, volunteers in 200 cities, exchanging information of how to handle a pandemic as we walk in. And as we moved towards February 2021, when each of the cities in the world faced shortage of beds, critical care beds. I challenge, if you have any friend in Mumbai, just ask them one question. Did they ever felt a need that the bed was not there available for them if they wanted one? And that was because of that night which gave us the purpose. Now, as the pandemic went away, I was part of IIT Alumni Council, which was volunteering it. And we had connected a very active 1,500 volunteers, almost 20,000 IITians connected who wanted to contribute to our nation cause. And there was a network which was built in more than 200 cities. And we realized that this opportunity, which has connected all of us together, should continue to be onto something larger. Now, of course, life, when this presents a purpose, it doesn't present in the form of any plan. It just starts with an urgency or emergency, and then it happens and unfolds. So some of our volunteers and leaders, our president and the chief volunteer Ravi, some of the council members who are experts working with the top leadership of the country, they felt that why don't we convert this entire initiative into something which can create a long-term sustainable voice for helping India to enable clarity of developing technologies for the missing gaps in the frontier areas. Now, just to give you my background, I trained as an engineer, did my management into operations and technology management, purchased oil and specialty chemicals for an FMCG industry, sold medical devices and healthcare pharmaceutical products into Indian subcontinent. Then as an entrepreneur, started a financial consulting firm, had finished my law to survive between accountants and lawyers, and still at the age of 50 was wondering what the heck I'm doing. So that's an overstatement for clarities and expertise. I had none about myself. But I had one definitely passion and a purpose, that I can be the connector, contributing towards bringing the experts. And so of us, in few of the IIT Alumni Council members, to say that we'll bring together the experts. And we started ideating, and we came up with this whole Trinity concept. It was inspired by Trinity of having megaspheres, observers, and accelerators. Now, in our culture, we all understand the importance of the Trinity in creation of this universe. The megaspheres was the energy of creation and destruction at one side, that the areas which we want to impact. Observers are the think tanks which actually will be able to look at the megaspheres with an expert's eye and help us to understand where to allocate the resources if the idea starts taking a shape into accelerators. And the megaspheres of the 9 areas which we talked about is inspired by Navdurga. So we talked about healthcare, well-being, and longevity as a concept of thrive. We looked at innovation and invention as create, education and knowledge to learn, economy and capital to prosper, science and discovery to explore, governance and community to unite, to transcend for a higher purpose, sustainability and compassion to serve, and space, scale, and new frontiers, including defense, to expand. Now, these were not just the ideas and the thoughts. These are areas which India needs to really work on, the frontier technologies with AI coming in, if India has to take its justified position on the global stage. So these are just the platforms where we invite young minds, startups, people who are interested to put risk capital, and thought leaders to come together, have conversations, and see if we can really create something of value to put into our accelerators. While I understand capital and governance, but something closest to my heart is the longevity platform, where I believe that AI will lead us to get into digital footprint, or digital mirror. Now, interestingly, if you really look at, there are more than 160 alternate healthcare systems which exists into the world. And more than 180 countries follow that. 80% of the world population has actually at some point of time used this alternate medical sciences. But we have not been able to comprehend and integrate this. AI will help us to do that. And this integration of 5 dimensions will create the digital twin of human health, working on the powerful analytics engine of creating age genomics, will actually link it to our energy centers, and then the harmonic of our cognitive bias, creating individual pathways for us to actually move a precision medicine to next level, to lead this initiative. What we need is young minds to come and contribute. If COVID was the fracture, longevity is the foundation. And if we all come together, we will win. That's our thought and belief. Thank you.